Welcome to another lesson on healthcare knowledge. Today, we're going to talk about in-network versus out-of-network services. We'll first show you how to find a physician or facility accepted in your plan's network, and then explain the difference financially. You'll need to grab your membership card. Now go to anthem.com website and click on Find a Doctor/Find Care at the top of the screen. Next, for best results, click on Members. You'll create an account with your member ID number. Doing so will confirm that your healthcare providers accept your plan. You can then select the type of service and how big of a search area you're willing to pursue. From this list of the filtered criteria, you can click on View Details for more information. You can locate a physician, surgeon, oncologist, OBGYN, any specialist, or any facility in your plan's network that can fill your needs at a convenient location for you. Hey, quick sidebar. If you already have a primary care physician or PCP, see if their name is on the list. If not, they are out of your network, or they did not accept their plan's benefits. If that is the case, then your insurance is not working for you. This thought leads us to the next step: how important it is to find a PCP that is in network. Let's say you ignore our suggestions, heaven forbid, and you go to a specialist that isn't in network. They don't take your insurance and you have surgery. Now, here is where it gets a bit deep. We're going to dig into your deductibles, your coinsurance, and your out-of-pocket maximum. Normally, in your open enrollment meetings, the dollar amounts that are shared with you are in-network values. It's expected that you would go to a healthcare provider that takes your insurance. Thus, the reason for this video. So, for instance, your deductible or the amount you must meet before your coinsurance kicks in, let's say in-network deductible is $3,000 individual, but the out-of-network is going to be $6,000 for individuals, probably $12,000 for family. When you go to an in-network provider, those claimed dollars will go to that in bucket and go to that deductible. When you go to an out-of-network provider, those dollars will not go toward the same deductible. They go in the out bucket. So, because this surgeon or the hospital is not in network, you are starting fresh with your deductible, and you have a much higher goal to reach before your coinsurance kicks in. Coinsurance is the percentage that your plan pays. Again, the out-of-network is usually different than the in-network coverage. For example, you might pay 10% of your in-network claims, but you might have to pay 50% out-of-network. The out-of-pocket spending will add up fast, and it will keep on going because you're out-of-network. The out-of-pocket maximum is most likely twice as much as your in-network maximum. This extreme spending can be avoided. It just takes a minute to be sure your care provider or facility accepts your plan. Whenever you have a doubt, ask before you set an appointment. Obviously, if you have any questions, contact your MB account team or connect with the MB advocates.